Good afternoon, Dr. Hill from Downtown's Healthcare. And what I wanted to talk to you about today is something that comes up quite often in our office when I'm treating people chiropractically. People ask me personally, how do you know where to treat somebody? Is it based on their pain? And the answer to that question is sometimes, but more times than not, no. One of the things that we do when we have a new patient come into the office is we do a very extensive and thorough examination on them, and we're actually looking for something called a subluxation. That's a chiropractic word. It's less than a dislocation. It basically means that one or more of these vertebrae have even millimetrically, minutely shifted out of place to the extent that the nerves here on the side can get irritated and pinched, and it literally just takes a dime's weight of pressure on there to reduce the nerve flow to the muscles and organs of the body by up to 60% with no symptoms. So we're looking for subluxations. During the exam, if there's a loss of motion in the spine, if there's muscle spasming, if there's arthritis in the spine, those are all telltale signs that there's subluxation. We can see that on an x-ray. We can see that in somebody's posture. In other words, if we look at someone's posture, we notice their shoulders are low, we can say that there's misalignment in the area of their shoulder. We don't know exactly where that is. And then we can also find subluxation by palpation. In other words, I can actually feel the spine, and the spine should have what you call joint play. So everything in the world that's mechanical has joint play. It has this springy component to it. If it's got that springy component, if these vertebrae have those springy components, then generally speaking, the vertebrae, the joints are healthy and do not need to be aligned. But if I push on the spine and it feels like I'm pushing on the wall, that's a loss of joint play, it's a loss of joint dynamics, joint function, and then that is the issue. Once I figure out where that is, I have to figure out if it's in this direction, if it's in this direction, if it's rotated either directions, or it could be what we call coupled motion, which means it could be a combination of those things. Okay? So what I'm going to do today is I'm going to actually look at Madison, our lovely model here, and we're going to look at her posture, which we call the window to the spine. So this is one way of finding subluxations in between taking x-rays. So we're going to have Madison stand up, and we're going to have her look at the camera. And what I'm going to be looking at, go ahead and look straight ahead, Madison, is we're going to be looking across her shoulders. And what you might notice is that her right shoulder is down. And then I'm going to put my hands on her hips. And I notice her right hip is lower on the right side. So that tells me a couple of things. It tells me that she may have what we call subluxations between the shoulders, right at the bottom of the neck, upper back, and that she probably has some misalignment in her pelvic area. So Madison, we're going to get you to lie on your stomach for me right here. So we think that she's got some misalignment in one or both of these pelvic joints. And so we can look at the leg length of her legs, and her right leg is shorter. And then I can actually go to the hip and I can push here versus push here. So this left hip has a real nice springy feeling, and the right does not. Do you feel that, Madison? Do you feel the difference?
Yeah.
Okay. So that tells us the right hip is what we call subluxated, and we would be giving her a chiropractic treatment, which we call an adjustment. So let's have you turn on your left side down towards me. So every patient receives not the same treatment. Every patient receives a customized, personalized treatment just for them, just for their condition. When we give a chiropractic adjustment, oftentimes we use a very quick movement, and that is to keep her muscles from overreacting and keep the treatment nice and comfortable. So you probably heard a little click or pop. That click or pop is actually air being released into that joint, which is incredibly beneficial and therapeutic There's endorphins, which are your body's natural painkillers. There's lubricants and nutrients that are released in that area. Now go ahead and lie on your stomach for me again, please. Thank you. And so if I go back in here and I push on that joint, Madison, you tell us, here's the left, and then here's the right. What do you notice when I push on the right now?
It moves better.
It moves a lot better. So that's how we find what we call subluxations. That's what we're treating here in our office when somebody comes in for chiropractic care. If you're receiving chiropractic care, that's what your chiropractor is doing to you. All right, I am Dr. Hill with Madison here with Downtown's Healthcare. We're at downtownshealthcare.com. Thank you so much.